Depression is a major psychiatric illness which affects around 4% of the population. Now, why does depression occur? Depression occurs because of a chemical imbalance in the brain. There are certain neurotransmitters, the main one being serotonin, and when there is a decrease in serotonin in the brain, you get symptoms of depression. And why does depression occur? So, the main causative factor is that there is a chemical imbalance. The neurotransmitter serotonin is less in people who have depression. Along with that, of course, there are stressors. So, it could be a bereavement, it could be some problem in the house, it could be loss of job. All these are stressors which also cause the chemicals to go low, and because of which you get the symptoms of depression. So, what are the symptoms of depression? Symptoms of depression can range from feeling low and completely disinterested in what is happening, feeling teary-eyed, having a feeling of hopelessness, helplessness, guilt. People also get suicidal thoughts. Then there are the other symptoms like lack of energy, decreased or increased sleep, appetite loss, increase of appetite, decrease in sexual desire. So, all these things, when you put them together, can cause depression. And depression is actually easily treated if you recognize it early enough. And what are the forms of treatment? You have medication. What does medication do? Medication increases the serotonin levels in the brain and therefore makes the person feel better. Besides medication, a very important part of therapy is talk therapy or counseling, as we call it, which can be in the form of different types of therapies like cognitive behavior therapy, interpersonal therapy, narrative therapy, etc., etc. Now, doing medication and therapy together is the best form of treatment for people with depression. So, the earlier you recognize the problem and the earlier you treat it, the chances of the depression getting resolved are much higher. So, there are several myths attached to depression and also to other mental illnesses. One of the things is that one has to be strong, and if you are strong and if you have the willpower, you can get over depression, which is completely not true. It is a chemical imbalance, so it requires help with medication and talk therapy. Another thing is that people just feel very hesitant to go to a mental health professional for help because you always feel that, either that, well, if you go to a mental health professional, you're either mad or you are not strong enough to handle this on your own. So, there is a big stigma attached to mental illness, and if we are able to look at it as just an imbalance in the body with psychological symptoms, one would be able to address it and get it recognized much earlier.